there's obstacles in our path. So it kind of like, it's a little bit like life, right? We're going to knock things over when we don't mean to.
We noticed a change in Noah in the summer of 2022, and he started withdrawing from his normal activities. He became less active, and he became kind of moody. He was diagnosed with amplified musculoskeletal pain syndrome.
It was tough, and after a while, with a lot of doctor's appointments, they didn't know what I had, so it took like a year to find it out.
He was in pain all the time, and there were times that he was unable to walk. He was unable to bathe by himself. He was unable to do just normal activities that any 8-year-old would be able to do. He wasn't able to participate in recess or in PE during school. We came here and met with a team of doctors, and we talked to Dr. Lockery, Dr. Galaxy Lee, Dr. Davis about what Noah's life was before, what his life was now, and what our goals were for his future.
Here at Nemours, we have a multidisciplinary pain program. And the biggest thing for us in Pain Clinic is that we want kids to be able to do and be and act as much like a kid as they can, regardless of what it is that they're dealing with. As part of his participation in Meeting Me in the Pain program, I also talked to his mom about participating in this ADAPT program. So this is where I think we tied everything together for him of being able to actually do things that he wanted to do and be around animals and teach him the coping skills by using the animals as a guide.
How the ADAPT program started, it started right before the pandemic. Before then, I would actually volunteer my lunch break with Gypsy. She was 7 years old at the time. We moved down from Baltimore, and she was a registered therapy horse through Pet Partners. And patients would kind of come do little meet and greets, and the power that I saw of her interacting with our patients and families and even our staff was amazing. If we could do that within a few minutes, what could we do if we actually made it into an official program?
ADAPT stands for Assisted Dog and Pony Therapy. So we partner with miniature horses and dogs in psychotherapy sessions with our psychology providers.
It's 100% donor funded, and we're trying to always raise awareness with that. We treat kids that are suffering from anxiety, depression, OCD. A lot of our children have chronic conditions, and they are referred to our psychology team, and they help them cope and go through different things, just as similar to the story of Noah.
We know that families need a lot of different things when they're managing a child with a chronic illness. ADAPT blends itself beautifully because this is well beyond medicine.
We have a lot of research that has shown that, in the presence of an animal or even being outside, that it's reducing our blood pressure, our cortisol. So we have a lot of stress reduction just in the presence of being with the animal. It really provides a really great situation for the patients to open up and really become, more receptive to, their treatment plan and a little bit stronger with their provider as well.
We think it is so important for us to be on the leading edge of not just physical health and specialty care, but mental health with the ADAPT program. And ultimately, we want every kid to have the same access to not just mental health, but this type of mental health, so that kids all around the country, all around the world can start to feel better. And that's the ultimate goal.